Our group did the Canadian Model of Occupational Performance, also known as CMOP.
The history of CMOP is it was developed by the Canadian Association of Occupational Therapists in the year of 1997. It evolved from the occupational performance model. This model was further expanded into the Canadian Model of Occupational Performance and Engagement, also known as CMOP-E, and the main focus of this model is on occupational performance.
The Canadian Model of Occupational Performance emphasizes client-centered care and spirituality, anything that motivates or inspires a person. So think about how spirituality plays a role in your life aside from religion. This model illustrates how occupational performance evolves from the interactions among the person, environment, and the occupation itself. The Canadian Occupational Performance Measure is the assessment based off of this model and will be explained in a further slide.
The theoretical base of our model is made up of three theories. Humanistic theory is evident in the emphasis on client-centered care, which is a very big part of this model. Think about the prevalence of humanistic approaches to history. Developmental and learning theories are also part of the base. These are portrayed in the belief that the person has the ability to adapt and acquire skills. The last theory that makes up our model is environmental theories. These are acknowledged in how the model considers environment as a significant component and influence on human occupation.
So there are three components that make up the CMOP. The first one being the person, which consists of cognitive, affective, and physical aspects. This also consists of self-identity, self-direction, and occupational base. The CMOP involves spirituality being the core of the person. And here we have a definition of what spirituality is. The next component is environment, which consists of physical, cultural, institutional, and social aspects. The last component is occupation, which consists of self-care, productivity, and leisure, and is the link between the person and their environment. Here we have an illustration of the different components within the Canadian Model of Human Occupation.
So here we're going to look at the function and dysfunction, and we have a short little video.
Function occurs when all three components, the person, the occupation, and the environment, work together in harmony. Dysfunction occurs when there is a disruption to any one of the three components, such as an injury to the person, an unfamiliar environment, or a difficult occupation.
So after looking at this video, by this definition, do you have any dysfunction in your life?
So there are one assessment in particular that was developed for the CMOP. It is called the Canadian Occupational Performance Measure. It's also abbreviated COPM, so the same letters but in a different order. And it is a structured list that the therapist and the client can walk to together with focusing on a client-centered approach. So first off, the client will define the problems that they're having in their life and then rate them from least to most important, and then address them also on a scale of 1 to 5, being what do I need to improve now and what can kind of be put on the back burner to discuss later. And then they will rate their performance on their daily occupations as seen in this video here. And then finally, they will reassess throughout the therapy process on how their performance and their satisfaction are going. So here is the therapist talking to the client about how she performs her daily occupations.
I'd like to get a sense from you of how you think you're doing now with those things and how satisfied you are, so that when we look back after, a few weeks, we'll be able to see if we've made a difference. So let's do them one at a time. There's the performance scale, and it goes from 1, not able to do it at all, up to 10, able to do it extremely well. So I'll ask you about each of those 4 things again. The first one, the one that you said is most important, is your ability to work or to spend the main part of your day in a way that's meaningful and feels worthwhile to you. How do you think you're doing?
Yes, so most practitioners who use the CMOP will use a similar guideline as listed here.
And the role of motivation using the CMOP, it allows the client to play a role in treatment planning. It's engaging the client. By engaging the client, it also increases compliance. Motivation comes from engaging in meaningful occupations. Therapists can inspire motivation by therapeutic use of self, so the development of a healing relationship between client and therapist.
Here we're talking about change strategies. So we're going to set goals that are applicable to life and also that are important to the client. We detect changes in a client's self-perception of occupational performance over time, and we also initiate the conversation with clients about performance issues in everyday living. So this could be talking about facilitating, guiding, coaching, just listening, reflecting, encouraging, and collaborating. And ultimately, it's up to the client to lead themselves where they want to go. And then just some current research. We actually found this in AJOT, and it was an article titled Measuring Client-Centered Outcomes in an Occupational Therapy Student Teaching Clinic using the Canadian Occupational Performance Measure. So it documented the use of COPM in the student teaching clinics to show the improvement of patient outcomes. The COPM was used in part of the CMOP to evaluate patients and compose occupational profiles. And it was shown that COPM was an effective form of patient documentation across a wide range of patient age and diagnoses.
Here we're going to apply this model to the case study of Adam, and the way that we're going to do it is through using the COPM assessment tool. So the first part of it is, in this model, is the core of spirituality. So in terms of Adam, he thrives on challenges and does not let difficult situations get the better of him, and he values being able to work 70 hours a week and believes his job cannot be completed without him. His motivations come from excelling and extending himself to the fullest, so hard work, and his goals for therapy are to return home and to work as soon as possible. So his main problems are having to do with his myocardial infarction and his coronary artery disease. So like that we showed in the video, we're going to have Adam identify the occupations that are important to him for him to get back to doing. And based on his case study, we decided that work independence, stressing, such as self-help task, traveling, and being a father would probably be his most important occupations in his life. He is then going to score his performance on how he thinks he's currently participating in these occupations, and then he will be reassessed holistically throughout the therapy process to kind of see his progress and where his satisfaction is laying with his progress. And then these finally are our references.